Hello, I'm Dr. Marilyn Arguillas. I'm a gastroenterologist practicing in Davao City, and my clinic is in Davao Doctors Hospital. Today, I would like to talk about World Hepatitis Day. Every year, we celebrate World Hepatitis Day in order to raise awareness about chronic hepatitis. Viral hepatitis is one of the most common diseases or infection in the world today. In fact, in our country, a lot of patients with chronic hepatitis B do not know that they have chronic hepatitis B. So the theme for World Hepatitis Day is finding the missing millions. We don't know who has hepatitis B because most of them, they don't have symptoms. So finding the missing millions will lead to better patient care because now we have medicines for both hepatitis B and hepatitis C. So viral hepatitis is a common infectious disease. There are 5 types of viral hepatitis, but 3 of them do not go into chronicity. So we're concerned with only 2, viral hepatitis B and viral hepatitis C. Viral hepatitis B is the more common infection in our country, but it's difficult to get viral hepatitis B. It's not easy to get it because it is usually blood-borne infection. So, blood-borne infection meaning direct blood-to-blood contact. When you use razors, nail cutters, when you get a blood transfusion from an infected individual, that's blood-borne. If you are in the healthcare industry, if you have a direct needle prick injury and the patient is positive for hepatitis B, those are the occasions when you can get hepatitis B. The other 2 ways to get viral hepatitis B, in Asia, unfortunately, the most common is mother to child through perinatal transmission. That's the reason why we have vaccines for the newborns in order to cut transmission from mother to child. And then the third would be sexual transmission. Yes, viral hepatitis B is a sexually transmitted disease. Viral hepatitis C is also blood-borne, but it's less common than viral hepatitis B. And today, there is already cure for viral hepatitis C. So, chronic hepatitis C is no longer the problem because affordable medicines, oral medicines, are available to cure viral hepatitis C. So we need to focus our attention on patients with viral hepatitis B, with chronic hepatitis B, because these are the patients who are walking around, not feeling anything, and they don't know that they're infected. And they only know that they're infected when they go through screening procedures, either for a job application or for enrollment to medical or paramedical courses. So, how do we find the missing millions? Because there are no symptoms in majority of the patients with chronic hepatitis B, screening should be done. So, there have been so many advocacies for viral hepatitis B, for chronic hepatitis B. And the first advocacy is to find the missing millions. So, be tested. So, screening procedures are done. And then, be treated if they need to be treated. But most important is to be vaccinated, because vaccination is the best way to prevent chronic hepatitis B infection. So, I mentioned how you get viral hepatitis B. So, most common in Asia is mother to child during birth. So, this is the reason why we have birth dose vaccinations already. And you need to complete the 3 doses. Second way to get hepatitis B is through sexual transmission. So, sexual transmission, since it is an STD, a sexually transmitted disease. And then the third would be direct blood contact. So, direct blood contact, this is the reason why we test blood donors for hepatitis B. We also test the blood so that we know that the blood is safe. You test for hepatitis B, you test for hepatitis C, and you test for HIV. In order to find out who has viral hepatitis B, ideally, everybody should be screened because in our country, the prevalence rate is more than 8%. So countries with prevalence rates 8% and above are considered high endemicity countries. And the latest figure from the research studies have shown that we have nationwide we have a 16% rate of positivity for hepatitis B surface antigen, and NCR, I think it was about 9% in the last study that was done. This was in 2014, published in 2014. So we need to find out who are the 16% who are positive. So ideally, every contact with the doctor, you should have a screening procedure in order to find out if you were infected with hepatitis B. So a positive HBs antigen will mean that you probably have chronic hepatitis B, especially if you don't have symptoms, but you need to be evaluated by the doctor in order to find out if you are positive for hepatitis B as a patient with an acute hepatitis B, or this is positive for hepatitis B because you had chronic hepatitis B and you didn't know it. And this is usually the scenario that we get when patients are referred to my clinic. So they apply for a job or they enroll for a course, nursing, medtech, etc. And then they find out that they are positive for hepatitis B. And they never knew that they were positive for hepatitis B. So what do? So we screen the patient. We find out if the patient has hepatitis B, chronic hepatitis B or not. If the patient needs to be treated because there is treatment, or if the patient needs to be monitored. So when we find the missing millions, we need to categorize them into patients who need to be monitored, and there will be majority of them will just need to be monitored, and to categorize them into those patients who need to be treated. So there is treatment for chronic hepatitis B, but not all patients with chronic hepatitis B need to be treated. Majority of them will need to be monitored until such time when they need to be treated already. Okay, so what do I mean by this? So when we find out what is your status for chronic hepatitis B, are you chronic hepatitis B who needs to be treated? Then there are several tests that you need to undergo, because if you need to be treated, we need to find out what is the ultrasound of the liver. If the liver is normal, if the liver has fatty liver, we need to find out if that liver is soft or not, so we need a fibroscan. And most important is to find out whether the patient has already liver cirrhosis. Here in the Philippines, most cases of cirrhosis that we are encountering used to be due to chronic hepatitis B. But now we are seeing patients with liver cirrhosis that are not related to chronic hepatitis B. It's more related to fatty liver and to patients who are diabetic or obese. So it's a metabolic liver disease. But that's another lecture. So we focus on patients who need to be treated after they are worked up for hepatitis B. And what do we mean by treatment? Treatment is oral medication, and the oral medications that we have that are available are already affordable. So because we have treatment that are affordable, we need to find who are those patients with chronic viral hepatitis B. So when we say treatment, unfortunately, chronic hepatitis B treatment is only to control viral replication in order to prevent liver cirrhosis, the development of liver cirrhosis, and in order to prevent the development of liver cancer. Because this is the natural history of chronic hepatitis B. When you develop chronic hepatitis B, You can have chronic hepatitis B for a long time without any symptoms. But when you need to be treated, you need to be evaluated because when the liver is fibrotic, so hindi pa siya cirrhotic, fibrotic lang. Ultrasound will not show fibrosis. Ultrasound will not show if the liver is becoming stiff, so you need a fibroscan. Because we want to prevent fibrosis from becoming cirrhosis. Because once the liver is cirrhotic, it's a garden for developing liver cancer. So ultimately, the goal for treatment of chronic hepatitis B is to prevent liver cirrhosis and liver cancer. So how do we monitor patients who have chronic hepatitis B but do not need to be treated? So at least once a year or twice a year, you need to check your viral load if there is viral load. You need to check your markers and you need to check your serologic markers. So because of the cost, at least once a year, you should go through the monitoring with your physician. Because as I said, you don't have symptoms, and then if you wait for symptoms to occur, it might be too late. So monitoring is regular checkup with your doctor. When you are treated with hepatitis B oral medication, you also need to be monitored by the physician because the goal for chronic hepatitis B treatment is to prevent liver cirrhosis. So what we need to find out is if your viral load has gone down, if your SGPTs, the serologic markers, have normalized, and most important is to do an ultrasound. To do an ultrasound whether the liver is normal. Studies have shown that even in patients with fibrosis, treatment with oral medication for chronic hepatitis B can regress fibrosis. So we are not saying that liver cirrhosis can be reversed, but we are saying that fibrosis can be regressed. So I have seen many patients with chronic hepatitis B who have changes in their liver on ultrasound and on fibroscan, but with continuous medication, they're able to go back to normal ultrasound and less fibrotic stages. So because most patients with viral hepatitis B, chronic viral hepatitis B, have no symptoms, if you have not yet been tested, please go to your doctor, have a test, be tested, so that we will know whether you need to be vaccinated or you need to be treated or you need to be monitored. And if one family member is positive for hepatitis B, it's important that all family members, including household contacts, should also be screened for viral hepatitis B infection. So this is the time of COVID. Most of our attention has been focused on prevention of COVID. Yes, there is no treatment for COVID. We don't have a vaccine for COVID. But we can practice by public health education. We and the other people, we can tell them to please use the mask and use it properly, covering the nose up to the chin. Ideally, it should be with a facial shield, so double protection. Wash your hands, and if you cannot wash your hands, you can use your hand sanitizer or your alcohol. Don't touch men, mouth, eyes, and nose. And most important, practice social distancing. Ideally 1 meter, ideally 2 meters. But please practice social distancing. And if you see people who are not doing these preventive measures, it's also our responsibility to tell them that they should use face masks, face shields, practice social distancing. So the bottom line is, in this time of COVID, we should not forget that we also are having a battle, waging a battle with chronic hepatitis B. And we already have the weapons. We have oral medications. However, We need to find the missing millions who will benefit from this oral medication. I hope you find this talk educational, and wait for the Med Talk series on hepatocellular carcinoma or liver cancer, September 2020.